Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958.
The key is that there are many different less invasive approaches into the hip. So you can do a single incision technique, which we do.
So what happens in end-stage osteoarthritis? You basically lose the cartilage surface, okay? And bone on bone, here, very, very painful.
Lack of oxygen can delay healing. Adequate oxygenation will help the healing. Nutrition, improving the protein, the calories, the vitamins, all that will help. Controlling the infection.
You can see there's quite a few people just in this room that are taking a beta blocker, okay? And that's because they're amazing medications for blood pressure and for other reasons, and I'm going to talk about those in a few minutes.
Here we have a picture of an artery. Here's the artery. So here's the blood flowing through the artery. Boom, right there you saw that little plaque rupture. And now you can see blood clot starting to build up and form in this artery. Now, why does the plaque rupture?
I raised 3 kids. I think I know a thing or two about doctoring.
Presenting the InHealth channel, a much better source of information on issues affecting your health and safety. Brought to you by Washington Hospital.
The center's comprehensive approach combines a wide array of advanced screening, diagnostic, and educational programs, and an expert clinical staff with a host of wellness and support programs designed to help women get well and stay well.
Welcome to Voices in Health. I'm Dr. Barbara Kostick. Washington Hospital is on the journey towards Magnet designation. The Magnet Award is the highest international recognition for nursing excellence. To achieve recognition, a healthcare organization's nursing staff must demonstrate outstanding quality and professionalism in the practice of nursing. The journey to Magnet recognition has value in itself, because it is a journey of discovery with innovation, quality, and improved patient care. The swine flu virus has some telling similarities to the devastating 1918 flu pandemic. This pandemic killed more Americans than all the wars of the 20th century combined. Well, tell us about the virus now. How widespread is it?
Well, currently in California, we probably have known infections into the thousands.
When it comes to a stroke, time is of the essence. In a matter of minutes, nerve cells are damaged, and within a few hours they could die, resulting in loss of memory, speech, motor control, and possibly your life.
But a stroke doesn't have to be this debilitating. Although brain damage does begin just minutes after you first feel the symptoms, if you get to the hospital fast enough, you can minimize the damage.
This newly amended mission statement, should the board choose to pass it this evening, it will be clear to everyone in the hospital that patient safety and best practices are not a project or a goal, but it is instead an intrinsic value of the hospital healthcare system.
We have a motion and a second. All those in favor?
Aye. Aye. When you were a child, did you ever take a magnifying glass and burn paper out in the sun like that? You could focus it right on the paper, but if you put your hand up here, it wasn't warm at all. Well, a Gamma knife does this in the same way, except it uses radioactive cobalt through 192 different apertures that focus down with such accuracy that it can destroy a lesion with about a 0.2 millimeter accuracy, which is pretty impressive.
I would argue that the purpose of the healthcare system is to keep people healthy. There's a big difference between healthcare and health, and somehow that got lost.
Healthcare costs are growing so much faster than our economy is growing that we cannot keep up with that.
We have to look at all of the alternatives out there if we're going to move the healthcare debate forward.
It's up to us now to decide how to reapportion our resources and cover everyone with basic healthcare.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access.
So it's clearly diet and environment.
It is. I think it's a fat intake. We do know by prostate cancer that if you go on a 20% diet, 20% fat diet or lower, your PSA will go down by 20%.
Well, you know, so maybe these guys are right about making weight their primary issue, their primary health concern, if it affects all these other areas too.
I would say that's cold, cough, seasonal illness. Other than that, she's pretty much healthy.
For both my children, their most common thing are just colds and the unexplained fever that lasts for a couple of days.
When they were babies, 2 of them were in daycare all day, so they tended to get a lot of sniffles then.
The important thing is, as the vaccines have become as effective as they are, the population that we deal with now, the current age group, has never seen the illnesses that we're trying to prevent.
Bam, 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 bam. I've been waiting to do it. The last dessert I have, they looked so good. You know, you turn on the light in the oven, they look nice and shiny and plump, and then they shrunk on me, okay? They're made with fat-free cream cheese and light cream cheese, and fat-free sweetened condensed milk. So, you know, these products weren't available years ago. Fat-free sweetened condensed milk, that's kind of a new thing.
Adding to our current state-of-the-art cardiac care program with expanded facilities, including operating rooms and more patient beds for those who are at risk or who have suffered heart attacks. And now we're about to embark on the largest construction project in our history and the largest public works project in the Tri-City area.
Couldn't help overhearing about your migraines. I'm not surprised, there's a lot of interferons floating around this place.
I had no pain. I could speak, I had no pain at all. I was bewildered. Deanna!
What's wrong?
I can't move my leg. I can't move my arm. I can't move.
Wait a minute, let me just call 911. Hi, 911? Yes, I believe my husband's having a stroke.
Time is critical when a stroke occurs. The Sorensens did the right thing, and their prompt action and call for help changed his life. What to do when you're having a stroke? Next on Inside Washington Hospital. A trip to the hospital can be daunting enough for an adult. But when it's your own child, you want to be confident that the best possible care is available. You want to know that your child is going to be under the watchful eyes of someone who cares about them just as much as you do. And that's exactly what you get here at Washington Hospital's Pediatric Center. A local, state-of-the-art facility, a comprehensive offering of services, and world-class care. Our green efforts go well beyond focusing on being more energy efficient. Robert Alfieri, Washington's Director of Facility Services, is in charge of everything that makes this facility work.
Green also takes into consideration not only the design of the building and how efficient it is, but the materials that they use in that building. Everything from the roofing material, to the asphalt, to the studs in the walls, everything that's part of it. And construction as well. We have a recycling program for demolition. Everything they take off site has to be recycled.
One simple way to make sure you are washing your hands thoroughly enough is to use the Happy Birthday method. Continue to scrub your hands vigorously long enough to sing the Happy Birthday song in your head. That should be sufficient to kill most germs, including MRSA. You may never have to see the inside of the Washington Hospital Emergency Department firsthand, but if you do, it's comforting to know that our facility and our staff are among the very best anywhere.